Hi, this is Bill Arnold. Missed a show or need me talking to help you sleep tonight? I have several solutions to that situation. Here are the podcasts from the show. You are the best for listening and supporting Faith Radio.
You are listening to an encore presentation of Afternoons with Bill Arnold. Faith, hope, and clarity in a special repeat performance.
And a warm welcome to Afternoons with me. I'm Bill Arnold. And, you know, our 11-pound head sits on this, like, bow tie-like bone called the atlas. And when that little guy gets out of alignment, the rest of us can be in trouble. I mean, it could be chronic pain and sleeplessness and a whole host of other issues that can cause a lot of trouble for us. And believe it or not, that little misalignment could have happened when you fell off a trampoline when you were 11. And you could still be in trouble, believe it or not. Now, my guest today is Dr. Kerry Johnson. He is one of less than 30 board-certified NUCA doctors, and NUCA is an acronym for National Upper Cervical Chiropractic Association. And he's, like I said, one of a handful of the 30 board-certified doctors in the world, and only one of a handful of credentialed instructors. And he is a master at diagnosing and correcting these structural problems in the upper neck. He has spent his whole career of over 35 years on that one bone itself, just that. And he came into my life several years ago. I was in a car accident, and I got T-boned. And if you know what a T-bone is, the car hits you from the side, and my head snapped to that one direction and then kind of snapped back. And then I was in a fair amount of discomfort and pain for about 8 or 9 months. And there was just, my head was stiff, and I couldn't move, and I was just kind of at wit's end. And I learned about NUCA from a friend, and I tracked him down, and I went and saw him, and voila. I think after about 2 or 3 visits, I was working back at 100% mobility and no pain, no discomfort. It was one of those amazing experiences. And I thought, well, you know, it's always good to talk and to educate people and to let them ask questions, because it is a fascinating study. And I want you to know, if you've got a question for Kerry today, you can send a text to 877-933-2484. Kerry, welcome to the show.
Thank you, Bill.
Yeah. Let's just talk a little bit about, I did my best to describe the atlas, but maybe you can elaborate on it.
Honestly, I was thinking as you were explaining it, I was like, wow, you do a better job than I do.
All right, let's go to break then.
Yeah. No, you're exactly right. And especially in childhood, our head is disproportionately bigger than our neck. And so it's very often those childhood injuries that create a structural problem right where the head meets your neck.
Yeah.
Nearly half of all of our head movements occur in the top 2 joints of the spine. And so it's designed for mobility, and because there's no discs at the top 2 joints in the spine, it allows for that greater amount of motion, but it's more susceptible then to injury. And when it does get injured or misaligns, it misaligns in way more complex ways than any other vertebra in the spine. Mm-hmm. And so the hallmark of the work that we do is our imaging. How we take an image of the upper neck and how we analyze what has happened there, which allows us to tailor a correction, which is unique for each person. No 2 misalignments are the same. I tell people that each person's misalignment is almost as unique as their thumbprint. But we can track down exactly how each person has been buckled and tailor a correction for each individual case. Mm-hmm.
And it's so interesting because the method involves a very gentle touch to manipulate the bones in the neck to eliminate any interference in your spinal column. I mean, it's so non-invasive. It's so gentle. You almost think, did anything happen?
Well, you remember, I tell you we're done with the correction, and you didn't feel me doing anything.
Well, I didn't think anything had happened yet.
Exactly.
But
exactly.
You said don't move your neck for about, I think you said, 2 hours or something?
Couple hours, yeah, be
which I
careful
didn't.
with movements, yeah.
Yeah, but then 5-6 hours later, I thought, oh my, I've got my full mobility back. And that was my first experience there.
Right.
And then I came back, I think, for another 4 or 5 visits just to see if I was stayed in alignment, because it doesn't always stay, but it stayed for me. And you guys would ring the bell, and I'd think, hey, I'm aligned, and you'd ring the bell. That's kind of cool. But then I had an experience with another friend of mine who lost almost feeling in his right leg, and his leg would almost collapse walking, and it was just horrifying. He was so afraid, and I think he had been everywhere. And I said, well, why don't you go see Dr. Johnson? And he said, I will try anything. And you had him back on the platform tennis court in 3 weeks.
Yeah. Well, when
Amazing.
when people learn that I only touch one vertebrae in the spine when we make the correction, then they would tend to think, well, I only work with necks. But I was a college student myself, halfway through school, with a lower back that was so bad I couldn't sit in a desk. And I was supposed to have fusion surgery because nothing helped me until this 65-year-old guy laid me down took these funny x-rays and laid me down on a little table and touched behind my ear, and my pain was gone the next day. I was like, what is this?
Yeah.
It makes perfect sense for me because I understand how it works. But really, in a nutshell, injury shifts your head on the top vertebrae. Okay? It tilts the head on your vertebrae. Well, the eyes don't like looking at the horizon unlevel. So the body doesn't stay that way. So in order to right the situation, we actually have a reflex called the righting reflex. In order to get our head back level again, then the body has to shift underneath that misaligned head neck. And so people walk around out of balance posturally right to left. And we look at their leg length when they're laying on a table, and you almost always will see one leg is pulled up shorter than the other. And it's that imbalance when we're not aligned and right with gravity that causes degenerative disc disease and breakdown, premature aging of our joints, bad knees, hips, and yeah.
And everybody has had an experience in sports or falling on the playground or smacking your head on something, jumping on a trampoline and falling off or something.
Trampolines, unfortunately, have been really good for business over the years.
I'm sorry to hear that. But,
I actually end up correcting about 1 out of 3 newborns. And so,
really?
Yeah, I believe 1 out of 3 people start their life with a misalignment at the very top of their neck. And yeah, normal childhood, 2 years old, the header off the top bunk, down steps, off bicycles, skateboards, you name it, sports.
But if you think of the big breaker circuit, all right, and that feeds electricity to all of the rooms in the house, and the breaker circuit is the main area where if that switch is not in place, the flow is not going to happen to all the other rooms.
Yeah, well, you really explained this well.
I'm trying to. I'm trying to. So
yes.
If you get the atlas adjusted correctly, it's like the breaker switch gets put into full motion, and then all the energy can start to flow through your body.
That, again, the very top vertebra, right where it meets your head, coming out of the bottom of your head is our brainstem.
Okay.
And the brainstem actually does not become spinal cord until it passes that very top vertebra. And so you have part of the computer sitting right up top. And so, you shift that thing and cause stress there. Not only does it throw you off posturally, but it can cause all other kinds of issues. And then the other thing, the upper neck is basically Grand Central Station neurologically because the brainstem is there. The vagus nerve controls your whole digestive tract, wraps right around the front of that top vertebrae. We have superior sympathetic ganglia, we have cranial nerve, all kinds of nerves that happen. And so when you shift the top of that neck out of place, it can affect you neurologically in a ton of ways. Now research is actually showing us that misalignment of the very top not only can affect you neurologically, but it can actually disrupt cerebrospinal fluid and blood flow in and out of the head. Nuke has done some research on migraine headaches, and I've been helping people with migraines for 35 years now, and I never dreamt in my life I'd be able to understand why that is. And now research in MRI technology is showing us.
Wow.
So it's fascinating.
So if you had issues like sleep or blood pressure or body balance or immune issues or digestive, facial problems, dizziness, that could all be related to an accident you had when you were 11 years old.
It can, for sure.
It's crazy. But
there's other reasons.
Yeah.
For high blood pressure and and a lot of these other conditions. So, and I'm not here.
I shouldn't have clumped that in because you don't have high blood pressure when you're 11.
No, but one of the only double-blinded studies that demonstrates that chiropractic and lower blood pressure was an 85-year-old NUCA doctor in Chicago. And it came out in 2007, and actually it rocked our profession. And now there's a half a dozen schools that teach this work that never used to, just because of that one study.
Wow. That's amazing.
Mm-hmm.
Yeah. Dr. Kerry Johnson is my guest, and he specializes in the treatment called NUCA. And NUCA, again, stands for National Upper Cervical Chiropractic Association. And this method involves a very gentle touch to manipulate this bone in your neck. And he has spent his whole career on that one bone. So you're the guy.
I'm a weirdo.
You're not only a weirdo, but you're the guy to ask questions to. So if you have a question about possibly if you would be helped by this procedure or process, and you've got questions, let me know what they are. You can send them over 877-933-2484. Again, 877-933-2484. I'll be right back with Dr. Kerry Johnson in just a minute.
You are listening to an encore presentation of Afternoons with Bill Arnold. Faith, hope, and clarity in a special repeat performance.
Welcome back to the show. So glad to have Dr. Kerry Johnson with me. He is over at Johnson Spinal Care, but he spends his whole career dealing with that one bone. What's it? We call it the atlas?
The atlas.
Is there a more technical term for it?
C1, first cervical or atlas.
Yeah.
C2, the second vertebrae is called axis because C1 pivots around C2. C1 is called atlas because it's supporting the world, our head.
Our head, yeah. And that's about 10, 11 pounds, our melons?
10 to 14 pounds.
Yeah,
I have a big head.
Yeah.
But I tell people because I have so many brains. But my wife says it's because I have a thick skull.
Yeah, I figured it was something like that. And you have not only a great love for this work that you do, Kerry, but you also have a great love for the Lord. And I remember when I came in, you didn't really know much about me. I didn't come in saying, I came in and said, I got neck problems. Mm-hmm. And after we had some talk and you were ready to do an adjustment on me, you said, can I pray? Do you mind if I pray before we start? I thought, yeah. And I think you probably do that with everybody, don't you?
We do. I mean, I don't pray individually with everybody. Yeah. We pray before every shift as a team.
Yeah.
For God's anointing, for His super to be on our natural. Mm-hmm. And we see some pretty cool things.
Mm-hmm. Let's see. Let me ask a couple of questions. I suffer from TMJ, and my neck and shoulders get really tight. Mm-hmm. It's hard for me to exercise, even because when I run or do anything with my arms, it goes up into my neck and it gives me headaches.
Okay. Well, that right there would indicate that there's neurological stress.
I would imagine.
Because every nerve in your arm comes out of your neck.
Okay.
And when you add stress to a misalignment, you usually have more symptoms. Mm-hmm. I always tell people, you can have this problem at the top of your neck, but if you're sitting on a beach chair in Hawaii, you may not have a lot of pain. But as soon as you have to do the things that our lives require of us, or even recreation that we like to do, then it will begin to squawk. Mm-hmm. Stress plus this thing we call a subluxation equals pain and dysfunction. Mm-hmm. Now, TMJ can be an issue all by its very lonely. If there's dental occlusion, that can throw off the function of the TMJ. Mm-hmm. So TMJ is kind of a funny one. Sometimes I'll see people have a TMJ problem that affects their upper neck. But other times I'll see an upper neck problem that affects the TMJ. A lot of times if it is an upper neck problem that's interfering with the TMJ, we will see a really large kink between the head and the neck so that the jaws wants to line and track with the head position. But if the neck's in a different position, then it causes these abnormal forces on the TMJ. And the TMJ is a really kind of a sloppy, shallow joint. And so, head and neck alignment is really important for normal TMJ function.
Mm-hmm. You were saying this during the break, but the question has already come in terms of migraines. I know you've helped people for decades with migraines. Tell me about that.
So the study that Nuka did, it was published close to 2 years ago now. What they found is that misalignment of the very top vertebrae can disrupt cerebrospinal fluid moving in and out of the head. And cerebrospinal fluid flows, it pulses with every cardiac rhythm in coordination with blood being pumped out of the heart. And so there's this coordinated movement between blood and CSF, cerebrospinal fluid. And what they found is that when you misalign the top vertebrae, it can actually make it more difficult for cerebrospinal fluid to exit the cranium. And our venous system, so our blood, our arterial system, it has two parts, the arterial system and the venous system. Arteries pump blood from the heart to the body, and then our veins return that blood from the body back to the heart. Mm-hmm. The arterial system is a high-pressure system, but the venous system is a low-pressure system. And so because that is the case, then cerebrospinal fluid blocks the flow of blood coming out of the brain as well. And then it just backs up the whole train. And so there's less actual total blood flow in the brain on some migraine headache cases. In fact, a lot of them. And so what we found is we correct that relationship. Patients will almost feel a change, like a warmth in their head. They'll feel like, wow, this feels different. And it really is that change in cerebrospinal fluid and blood flow in and out of their head.
Mm-hmm. It's that old cerebral spinal fluid. It's always the culprit, isn't it?
I just have to add this, and this probably doesn't have anything to do with anything except for how wonderfully we are made and how complex we are.
Amen.
But just within the last 2 years, researchers have discovered that during the deepest part of our sleep, our brain cells actually contract for about a half an hour. They actually contract so that cerebrospinal fluid can get into the smallest little crevices in our brain and wash it. See, cerebrospinal fluid washes our brain. It gets pollutants out of our brain because when we burn oxygen, it's just like our car burns gas and there's junk that is the remnants of that comes out our exhaust pipe. It's the same thing when we burn fuel. And so CSF washes our brain, and at that one moment during our deepest sleep, the brain cells actually shrink so that CSF can go in and do a thorough house cleaning. It's fascinating. And so somebody that maybe isn't going through all 4 phases of sleep properly, they're walking around with a tired, polluted brain.
That's so interesting. I've heard that OCD can be caused by an injury to the basal ganglia. Is there anything to that?
I've heard that.
Okay.
But I couldn't speak to the issue.
Yeah, that's fine. The headaches is a big deal. People that have issues with headaches and migraines, your explanation was really helpful.
It is, if there is one condition that's kind of bread and butter in our clinic, that is one of them. Mm-hmm. Sleep issues, headaches.
What about dizziness? People that have vertigo problems.
Mm-hmm. Well, there's a couple of kinds of vertigo, like most people have heard, and it's usually a middle-age problem where you'll get a crystal that shifts in your inner ear.
Yep.
That we won't help. But there's a procedure called Apley's maneuver that can help with that.
Mm-hmm.
And that type of dizziness is usually your head spins.
Yes.
Like it's a real spinning kind of dizziness.
Yeah.
The kind of dizziness that we typically will help people with is like balance type of dizziness, or like the room is moving, or they feel like they have sea legs. Mm-hmm. When they'll get up and it's just, the room is moving. That type of dizziness often will respond to a correction.
Mm-hmm. Does anything help with tinnitus or tinnitus? I mean, does Nuka help with that?
I would say probably 50, maybe 70% of our patients with tinnitus will have improvement.
Okay.
A lot of times it's ear damage that will cause it. People that have been in the military or you heard loud music.
There's just damage
construction,
there.
equipment, so there's damage to the ear that will trigger that. It's been my experience that when you're out of a line, it will be louder than if you're in a line.
Mm-hmm. So you have found people have found improvement from their tinnitus. That would be...
Again, not everybody. More than half, though.
Mm-hmm. Yeah. Here's another big word I can't pronounce. Trigeminal.
Mm-hmm. Trigeminal neuralgia.
That's it. Stop taking calls. We've got a winner.
That's a fascinating one. Let me tell you a story about that. I got a call from a lady who was head of the trigeminal neuralgia support group in Minneapolis. This was 20 years ago. 20 years ago. And she had been to a conference in Atlanta, and they had told her at this conference that there was a chiropractic procedure on the upper neck that could potentially help her. And so she had called me, and we talked about it, and then I didn't see her. A year later, she went to the national conference, and there was she talked to somebody else about this work, and so then she came back and called me. And so she came down, and they do a surgery called MVD, microvascular decompression. She'd had the surgery, but she was still on all these drugs. And so I corrected her, and within a month, she was off all of her medication. And she hasn't had a problem really since then. And, of course, she happened to be the president of the support group. So needless to say, over 10, 15-year period of time, we probably had 40 or 50 people with TN.
Mm-hmm.
Before powerful drugs, it was known as the suicide disease.
Oh, wow.
It's so painful. It gets such a pain there's three branches to the trigeminal nerve. It's a facial nerve, so they can have it in one of the branches or more than one. And so there are people that really suffer. And again, now with MRI technology, they do this microvascular decompression puts a little pad between the trigeminal nerve and one of the big veins that's coming out of your head. And so improving vascular flow out of the head is a way that you can relieve the trigeminal neuralgia without having to go into surgery and put the pad in between them. So back then I had no clue how we were helping people with TN, but we have. Not everybody. That one I would say very confidently we probably help 75% of the cases.
Mm-hmm. Wow. You've got 356 reviews, and 2 are not 5-star. That's impressive. Anyway, you can go to johnsonspinalcare.com, learn more about Kerry and his amazing staff. And we are still open to lots of questions. 877-933-2484. We're talking about that upper cervical, the top part of your spine. It's called the atlas. And if you have a question, let us know what it is, and we'll get to it. We'll be right back.
You are listening to an encore presentation of Afternoons with Bill Arnold. Faith, hope, and clarity in a special repeat performance.
Time. Let's get it started. Jump in your car. Yeah. What's for dinner? It's the Afternoon Show with Bill Arnold.
Welcome back to the show. So glad to have Dr. Kerry Johnson with me today from Johnson Spinal Care. Kerry helped me when I was in a bad car accident, and I got my car totaled. My car wasn't even that old when it was totaled. And my neck was stiff for about 7-8 months, and I was pretty desperate, and I finally said, I will do anything, try anything. And I heard about this adjustment from a friend who got a considerable amount of satisfaction because he had some issues in his shoulders. And he said, I got well and got recovered instantly. And I thought, well, I'm happy to try it. And I I went and saw Dr. Johnson, and I would say I had the same result. I would say within about one day I was better because my atlas was so out of alignment and it was causing such pain, and you moved it into place. Voila. I was feeling better. Now, we were talking during the break about you deal with a lot of NHL hockey players, and you can tell if they're out of alignment because they shoot and they miss.
Yeah, well, my son played hockey, and I could always tell when he had lost his alignment because he would lose his legs in the third period. He'd get tired. He would start dogging it. And so I noticed that, too, when I watch some of my skaters when they start losing their legs towards the end of the game. Because when you're out of balance posturally, you do not get complete rib expansion when you inhale.
Interesting.
And so when you have huge demands of oxygen like these players do, and when they're skating out of balance with this postural imbalance, they don't expand as well, and so they don't get quite the oxygen inhalation that they do when they're in a line.
Yeah, well, so I would imagine every hockey player is misaligned. Honestly, they get slammed into the boards.
Gymnasts and hockey players are the two worst athletes that I typically see, even worse than football players. Because when you think about it, you're in youth hockey and you put on skates, that means you're going way faster than if you're running. And then what happens at the end of the ice is something that absolutely doesn't move, the boards. And so these poor kids go in there head first into the boards when they're in, and they're still learning how to skate. And for sure, it's a real big issue with misaligning the top of that neck.
Or even if you fall on the ice and you don't necessarily hit your head against the boards or ram your shoulders into the boards, you still have gone down and maybe caused some snapping of the neck or something. Who knows what?
I'm amazed at these NHL guys that skate at the level they do, and they'll come in there, got their legs like an inch short. They're so out of balance. But
that's interesting.
Fascinating.
When I came into your office, because I'm a big hockey fan, and I saw some of the jerseys of people that you've worked on, and I thought, I'm not surprised that hockey players are a mess.
They are.
Yeah. Dr. Kerry Johnson is my guest, and we've got time for questions if you have some. A bunch are coming in, Kerry. What about sleep apnea? Is that something that's related to the atlas? So, obviously, the neck is it's very interesting structure, and there's a lot that's in the neck. So there's not a lot of extra space, and so obviously the apnea is really a closing down of our airway when we're trying to sleep, and position of our jaw due to, again, dental occlusions can cause apnea. Being overweight can cause apnea pretty commonly because now you got fat tissue taking up some of the vital space that our airway would have. So a lot of times people will notice if they go on a diet and they lose 40, 50 pounds, their airway's not closing down like it was. Sleep position can play a role in it, like somebody who sleeps with a bunch of pillows under their head and their chin's all tucked down towards their chest, that can close off their airway. But the misalignment of if their head and neck are not lined up right with each other, that can make your airway a little bit smaller. And so it's interesting because I'll have a lot of my patients, and I would say probably men have more issues with apnea than women by and large, but I'll have our patients will come in to get adjusted because their wife says, "You got to go get adjusted. You're snoring again." And so they know that's their indication that they need to get aligned. Yeah. Another question, Kerry, do chiropractic adjustments of the neck help? And then here's in parentheses, the ones they quickly snap the neck and make a sound. Are they safe?
So chiropractic has survived the persecution of the establishment, let's just say, for 100 years, more than 100 years now. Because when you mobilize a joint that's locked, that's fixed, and it moves better, the patient feels better and they get relief. And so I would say the cranial cervical junction at the very top, it is such a complex joint that the traditional rotational misalignments may not clear it sufficiently. In fact, most of the misalignment at the top of the neck it's a sideways problem. That's why we lay people down on their side when we correct it. So a rotational force may not clear the very top. may be very helpful for issues lower down in the neck.
Mm-hmm.
So, but in answer to the question, is it safe? Yeah, it's safe, and I can tell you why. So insurance companies have all of the information about
these kinds of procedures.
All medical procedures.
Yeah, right.
Right? And so as a healthcare professional, I have malpractice insurance.
Mm-hmm.
I pay about $1,500 a year for malpractice insurance, which is like a lot of people pay for their cars.
Yeah.
Okay? The insurance companies, they have all the metrics.
Mm-hmm.
So that should speak right then and there that chiropractic in all forms is safe.
Oh, yeah.
It's really hard to hurt somebody.
Mm-hmm.
But because we're the ones that get the press, though, when something does happen.
Mm-hmm.
You know, there's more than 100,000 people a year succumb to prescription mistakes, but that doesn't make the news.
Mm-hmm.
But if there's, 3 or 4 or 5 a year, usually if it's at the hands of a chiropractor, that will make the news.
Interesting. So I know that you have a deep desire to not only help people get them feeling better and more well, of course, but there's been a couple of occasions, a handful, where sort of the Holy Spirit led you, prompted you, made aware to you that the person that you were working on was going to be healed that day. I don't know if I'm describing this well. You told me the story in the green room, and I don't want to misrepresent what you were saying.
Well, I was sharing about a young man who heard about our clinic through your show.
Oh, cool.
I don't know if it was last time or the time before. And so our clinic was in Apple Valley, and his dad brought him down. They live up in Maple Grove, so opposite end of the city. And and this kid was having all kinds of unexplained neurological issues, like basically integration issues, like just clumsy movements, weird movements of his arms and legs, like involuntary types of movements, and they couldn't attribute it to any condition. And so his dad brought him down, and so I've seen this young man for a couple of years now, and he benefited, and things were improving. They faithfully would come down for a check once a month, and I really would have to make a correction about every month. There may have been one time that he was in a line. And so this past December, I'm tooling along. I'm pretty busy, so I see a lot of patients. So I tell people I'm like the polar bear at the zoo. I go from one room to the next and back and forth all day, and that's my life, and I love it. I just sailed into the room, and it was like 5 PM. I've been seeing patients all afternoon. And as the moment I walked into the room, all of a sudden this feeling came over me. Like there was a presence there. And I know what that presence was because I've experienced it before. And it was just God showing up. The best way I could describe it, Bill, is that I just walked in the room and I had this compassion that came over me. Like I'm picturing what Jesus said, like he had compassion over the people because they were lost, like sheep without a shepherd.
Mm-hmm.
What would that compassion of Jesus be like? Like almost an overwhelming compassion came over me. And it was so out of the blue. Like I hadn't been thinking about God or my faith. I was
you were working
doing
that day.
My job,
yeah,
right?
Yeah.
And that just overwhelming me came over me. So I adjusted him, and I'm trying to process this feeling. And I said, the only thing I could come up with is Lord saying, there's healing for this young man right now.
Wow.
I sat him up. I explained what I just explained to you to his dad. Always brought him down because he couldn't drive. And I explained to his dad and him, I said, I feel like the Lord is saying, there's healing for you right here, right now. Can I pray for you?
Mm-hmm.
I prayed for him, prayed over him. And when he left, a young doctor that was just joined our practice, she was actually clinical assisting, helping me in the back. When she walked into the door, she knew we were talking. She walked in the door. She felt the same presence. And she's just like this new believer. And she felt it. She was going to say something to me afterwards. Well, anyways, long story, even longer. He has not needed a correction since. and he came back, and he's had remarkable strides since December.
Wow.
And so I believe God anoints our hands and anoints us to do work beyond our own ability, but I also believe that God does miracles. And I guess at least for me, and I think he does it in all different ways, but for me, when I have that feeling, I know that God is saying, you got to pray, there's healing right here.
Mm-hmm.
So,
You just followed obediently.
Yeah.
I love that. Oh, it's great. So there's so many people across the country that listen to the show, Kerry, and they wonder.
It's because you're so awesome.
Well, I'm not saying that. I'm just saying, they're wondering. They can't get to you, but I know there are other providers that are across the country, and there's not a lot of them, is there? Or is there?
There's a few hundred NUCA doctors scattered throughout the country.
Okay.
So
if
I aim to increase that.
Oh, yeah, I know you are. But if I'm in Connecticut and I'm thinking I would like to find out more about this, and how would I go about trying to see if I could find a provider in my area?
Well, if you're in Connecticut, you're out of luck. Sorry. No, I'm just kidding.
Oh, good.
I will say that on the East Coast has been a big black hole for NUCA doctors, but it's starting to. Like, I just had a really good friend of mine. She moved from California to New Jersey, and so you still may have to drive, but there's more and more doctors that are coming out to the East Coast. But yeah, NUCA, nucca.org, and you open up that website, and they have it says patient. You click patient, and there's a directory of doctors around the country. And I would just say too, like, it's a small community, so I know a lot of them. So if you live in a community that has multiple, I'm always happy if you want to send me an email. Hey, who do you recommend in this community? Because I know the good ones.
That's awfully nice. How would they get a hold of you?
Kerry, Kerry, at johnsonspinalcare.com.
Kerry, Kerry, at johnsonspinalcare.com.
But one thing I do ask, put NUCCA in the subject line, because if I don't recognize the email, I won't open it.
Sure.
So, yeah.
Yeah, that's a good point. All right, we'll take a little break. We still have time for questions if you have them for Dr. Johnson, 877-933-2484. We'll be right back.
You are listening to an encore presentation of Afternoons with Bill Arnold. Faith, hope, and clarity in a special repeat performance.
Dr. Kerry Johnson is my guest today. He's a board-certified NUCA doctor. NUCA is an acronym that stands for National Upper Cervical Chiropractic Association, and it's this lovely little bone that God created and put in our bodies that our heads sit on, and it has some flexibility, doesn't it? Because it needs to, because our heads need to rotate, and it needs to have a little bit of play in it, doesn't it?
I asked the Lord one time, I said, why would you put this big old head on a little bone with only 2 joints and no discs, and then have the brainstem be right there as well?
Yeah.
Like, it seemed to me like it was an engineering, Lord, I could have did this better.
Yeah.
And, whether you believe God audibly speaks to you or not, what popped right into my head, and I believe it was the Lord speaking to me, he said, you were designed perfectly for what I intended. And, obviously when the world fell, like, I believe somewhere along the line, our gravity probably increased.
Sure.
Because we only lived to, 100, we're supposed to 120 years. Well, we lived a lot longer earlier. So what is that happened? I think it's gravity that's just driving us into the ground. And so this design is not ideal for the environment that we're in now, but it was ideal for what God intended for us.
Yeah, that's a great observation. Really, really interesting. Because we talk about that area in the neck, Kerry, as kind of Grand Central Station. You referred to it that way, and that is a great illustration. I think you have a great video on your website. Does that still exist?
Yeah, I think we do have one. Yeah, if you scroll down a little bit. It's like a whiteboard explainer of what this is.
It's about a 3-minute video.
Yeah,
and when I saw that, I thought, oh, does this make absolute sense?
Yeah. Well, thank you.
Yeah, because if that Grand Central Station doesn't have clearance and everything isn't running smoothly in that area of the neck, it's going to cause problems all over. And for me, I had pretty much a head snapping injury from a car accident, and you helped get me back to better than new.
Sure.
Yeah, so thank you for that.
Well, and some people can tolerate this misalignment better than others. Like some people have big bones and smaller nerves. And so a lot of times when they're out of line, they'll just have structural issues, back pain or whatnot, or degeneration or arthritis. But there's a lot of other people that have smaller bones and bigger nerves, and they don't tolerate a problem there or misalignment there at all. They'll have all kinds of neurological mess-ups. So, yeah.
And our bodies do kind of odd compensating, don't they? If there's pain somewhere, we're going to sort of physically try to adjust our bodies to alleviate some of that pain, even if we find ourselves walking a little funny or...
Yeah, for sure. It's the term is called antalgia often.
Say that again?
So, antalgia.
Okay.
And what it is like, let's say you pinch a nerve down at L5, which is the bottom lumbar vertebra. You pinch a nerve on the left side, and what will happen is the upper body will all lean way over to the right to open up the space to take the pressure off that nerve. And so you'll walk crooked until all the inflammation settles down, and then you can be straight again.
So your body kind of knows how to compensate.
Our bodies were made in the image of God.
Yeah.
And with all of the ability to heal itself. And this is where philosophy in healthcare comes in. Because fundamentally, people tend to think like I have to put something in my body for it to be healthy. Like that's what medicine is based on. But really, God designed our body to be a self-healing organism to overcome almost every disease issue that we have if we're treating it well. But also if you're in a line, it makes a huge difference. So there's a whole health side of chiropractic that people don't necessarily think about as well.
So when you have a treatment, explain what happens the next 4 hours after that. You just have to be careful not to make a lot of head movements. Is it a good idea to have somebody drive the car so you're not trying to check your blind spot too quickly or move your head?
Yeah, I just saw a couple from Fergus Falls this morning, and they're driving right home. Both of them got adjusted. And so I tell them I prefer, if they're coming from out of town like that, to just get a room for the night, but they didn't have that capability. And so then I always tell people, okay, here's what you do. Take a Sunday drive home. Just get in the right lane, stay there. If it takes you another hour to get home, then that's what it does. So you don't have to be turning your head, checking your blind spot. I would say after the very first correction that our patients have, most of them within about 2 hours of the correction will want to just go to sleep. They just get super kind of relaxed and tired and they want to go to sleep. A lot of times they'll get their first good night's sleep that they've had in a really long time. That's probably one of the more common things that I hear when I see them back on their next visit is, man, I went home and I slept better than I have in a long time.
Yeah, I would attest to that as well.
Yeah.
I mean, after my adjustment, I had an incredible nap, and I did a radio show at the same time.
There you go.
So, yeah, I mean, I did it all. So, yeah.
But, patients will feel malaise or tired. A lot of times they can almost feel just a little bit sea-leggish because when we change the position of the head and the neck, their brain has to get used to their body being in a different position. The first week or so, they'll experience different migrating aches and pains because if you shift the pelvis so that it's centered over their feet again, their knee is supporting their weight just a little bit differently than it was before the correction. And so that is an adjustment. So they'll get migrating aches and pains the first week or so. Most patients, even though they don't feel the correction, they know we did something.
Yeah, because the treatment itself is, I didn't even know that you were done. I said, is that it?
Yeah, right.
I thought you were warming up.
Right, yeah, exactly.
But you were already done.
That was the exact same experience I had as a chiropractic student.
Okay.
When I first got adjusted this way, and I drove home, my back still hurt. I was indignant. I was like, that guy was a waste of time and money. But I woke up the next day without any back pain, and I have never had any pain in almost 40 years.
And you fell off a ladder, didn't you?
Yeah, I hurt my back a year out of school, out of high school, fell 25 feet off a ladder.
Oh, my.
And I'm almost thankful for it because it got me into this profession. After my first visit to the chiropractor, I knew this was what I was going to do. I just had to do this. But as I was in school and chiropractic school, you're in class like 40 hours a week, and that sitting just made my back worse and worse and worse and worse. So, yeah, I was in misery.
Mm-hmm. And that was, your whole career has been focusing on this one bone. And
well, I went back down the next week and I said, Dr. Crow, what did you do to me? I have to know.
Yeah.
Because they didn't teach anything like this at the school I went to. And so he said, well, if you want to get some students to come down here on Wednesday evenings, I'll show. So my last 2 years in school, we were at his office every Wednesday night from 6 to 10 p.m. and took time out of his day. I give him credit because he would finish with patients, never even had dinner, and sit with us till 10 o'clock at night.
Wow. That's a dedicated guy.
Right.
Yeah,
right.
I don't do nothing without dinner.
Right.
Yeah. Rosie knows that to be true. So a question, there's people very interested, of course, and here is a question about someone who lives as far as 4 hours away that would like to come. But, how many treatments could I have if I come from that distance? And the truth is, it is a process, isn't it?
Yeah, I wish I could answer that question. I have people that live in the northern part of the state, and most of them, I will say, you got to make at least a weekly commitment for 4 to 6 weeks to come down.
Now, in my case, Kerry, I was better in one treatment.
Yes.
And I was miserable for about 8 months.
And you're probably 1 out of 10 patients that has that result.
I get it.
Where it's a one and done.
Right.
But that's not, and I'm just being honest, that's not the way it is for everybody.
I get it.
It's a process. I would say I have 1 out of 10 patients that gets that one and done. 1 out of 10 patients that I battle them for 18 months or 2 years sometimes. They've just had so much damage there. But it's worth it to them because their life has changed, and they'll make that commitment to stay with it. And there's 1 or 2 out of each on each end, and probably 6 out of 10 patients. It's 4 to 6 months for them to get stable, and then they do really well.
Yeah, and if there's damage there, and it's going to take a while for it to get repaired and restored, it's just not going to happen overnight.
I tell people, there's 2 considerations, the health of your spine and the health of your nervous system. And they're very intertwined because your spine houses and protects the nervous system. So the only way you can get stabilization of the spine in its aligned and right position is if all the connective tissue that supports it heals and stabilizes. Muscles, tendons, ligaments, joints, fascia. And so that's just a function of staying in a line really most of the time for that 6-month period of time, and that's where you'll get the stabilization. But I also tell people, so I tell every new patient, my goal really is that as we keep you in a line, you begin to feel better and notice your nervous system works better.
Yeah.
You sleep better, eat better, digest food better, eliminate better, socialize better, think better, move better. And they do. And so it's worth it for people, whatever the commitment is, to stay in a line.
Yeah. Absolutely delight, Kerry, having you here. Thank you so much.
Yes.
Fast hour. Dr. Kerry Johnson has been my guest. If you want to learn more about him and the NUCA treatment, you can go to johnsonspinalcare.com. That wraps up our show for the day and for the week. Thank you for supporting Faith Radio. See you next week. Thanks for listening. Programming like this is made available through your support. Information available